Senexon-S is a medication used to treat constipation. It contains two medications, Sennosides and Docusate. Sennosides are stimulant laxatives that work by keeping water in the intestines, causing movement of the intestines. Docusate is a stool softener that helps increase the amount of water in the stool, making it softer and easier to pass. The recommended daily dosage for Senexon-S is determined by your doctor, and it is best to take it at the same time each day. It is important to follow your doctor's instructions and not to exceed the recommended dosage. When taking Senexon-S, make sure to swallow it with a full glass of water, as directed by your doctor. If you are self-treating, follow the instructions on the product package. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. It's important not to take more than directed or use it for more than 7 days unless instructed by your doctor. Serious side effects may occur if you overuse this medication. This medication may take 6 to 12 hours before it causes a bowel movement. If your condition persists or worsens, or if you experience rectal bleeding, it's important to inform your doctor. If you suspect a serious medical issue, seek medical help immediately. And remember, always consult your doctor or pharmacist if you have any questions. If you experience stomach or abdominal pain, nausea, diarrhea, or weakness while taking Senexon-S, it's important to let your doctor or pharmacist know. This medication may also cause your urine to turn reddish-brown, but this is harmless and will go away once you stop taking the medication. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects, but it's important to contact your doctor if you have persistent nausea, vomiting, or diarrhea, muscle cramps or weakness, irregular heartbeat, dizziness, decreased urination, or changes in mental or mood. While a serious allergic reaction to Senexon-S is rare, it's important to seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience anything else unusual, be sure to contact your doctor or pharmacist for advice. Before taking Senexon-S, it's important to inform your doctor or pharmacist about any allergies you may have, especially to Sennosides, or Docusate, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have had appendicitis, sudden changes in bowel habits, bleeding from the rectum, or intestinal blockage. Additionally, if you are pregnant or breastfeeding, it's essential to consult your doctor before using this medication. And before undergoing any surgical procedures, make sure to inform your doctor about all the medications and products you are using. As always, it's best to consult your healthcare professional for more details. When taking Senexon-S, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Senexon-S is mineral oil. Be sure to inform your healthcare provider if you are using mineral oil while taking Senexon-S to avoid any potential interactions. Remember, always follow your doctor's guidance when it comes to taking medications. If someone has taken too much Senexon-S and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include ongoing nausea, vomiting, or diarrhea, as well as severe stomach or abdominal pain. It's important to keep all medical and lab appointments. If you're looking to prevent or relieve constipation, there are some lifestyle changes that might help. These include exercising, drinking enough water, and eating a proper diet with fiber-rich foods such as bran, fresh fruits, and vegetables. You should talk to your doctor or pharmacist about lifestyle changes that might benefit you. If your doctor has prescribed Senexon-S to you on a regular basis and you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, then you should skip the missed dose and continue with your regular dosing schedule. It's important not to take a double dose to make up for the missed one. As for the best time to take Senexon-S, it's best to follow your doctor's instructions for the most effective results. When it comes to storing Senexon-S, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. When you no longer need Senexon-S or it reaches its expiration date, it's important to dispose of it properly. Consult your pharmacist or local waste disposal company for the correct way to discard the product. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.